Pregnancy during the pandemic has been in the minds of a lot of women across the country.
And no one understands better than our own soon-to-be mom, Dina Kupfer. She joins us with more.
Yeah, good morning. So October, if you didn't know, is actually Pregnant and Infant Loss Awareness Month. And so many people out there have experienced loss, including myself and my husband. And we went through 3 miscarriages before we finally ended up on the IVF journey. And the last miscarriage we had, the very first phone call I made was to an infertility doctor named Dr. Aimee. And we were just chatting on Cat Public Radio a couple of minutes ago about being pregnant in a pandemic. And now she joins us here on Good Day Sacramento and CBS 13 to continue that conversation. So a little bit of a technical issue here, but we do have Dr. Aimee joining us this morning. So first of all, thank you so much for being with us. And I know you're very busy in San Ramon this morning at the office, but I know a lot of people who are struggling with infertility are still wondering whether or not the vaccine plays a role in infertility. And you are the infertility doctor. So I want you to be able to explain, Dr. Aimee, and your practice and what you've seen. Does the COVID vaccine impact infertility? And I think that's a question that a lot of people have been circulating around social media as well.
Right. I think that that's a really important question. When you're trying to get pregnant, when you're pregnant, you don't even want to take a Tylenol, right? You're so worried that something that you're taking could possibly hurt your baby. But I've had patients vaccinated since December. Pregnancy rates are better than ever. We don't notice an increased risk of miscarriages. And this has been studied by the CDC. People who have received the vaccine versus not received the vaccine, miscarriage rates are the same. So if you're trying to get pregnant, if you are already pregnant, and if you haven't been vaccinated, we are asking our patients. American College of OBGYN agrees that all pregnant women should get vaccinated at this time to protect themselves and their unborn baby. And the reason is because miscarriage rates are higher, stillbirth rates are higher, complications like preeclampsia, preterm labor, and preterm delivery are all higher in women who get COVID and are pregnant and unvaccinated. So please, if you are considering pregnancy, if you are already pregnant and haven't been vaccinated, your doctor is someone you can trust, and OBGYNs all around the country and world agree that vaccination is safe.
And ultimately, my husband and I decided that we would go ahead and I would get vaccinated. And I did that at 14 weeks pregnant and into the middle of my pregnancy. And I know a lot of people are wondering, will this have long-term effects on the baby? But now we're seeing that there could be antibodies, right? And so what is your guidance? Is there a time that somebody should decide to get the vaccine? And is there a better trimester than others? Or do you say first available as soon as you can?
First available as soon as you can. Obviously, it's such a personal decision, one that people take very seriously, but I feel based on the experiences that I have had that have been terrible in pregnant women who've gotten COVID and have had the complications that I've described to you, I wish that they had been vaccinated. Some of them were pregnant and got COVID before the vaccine was available. So I feel like vaccine is an important thing to get right now.
Okay, Dr. Aimee, thank you so much. We're going to have all of her information linked up to the Good Day Sacramento website. I know you're very busy. I appreciate you joining us. And again, we'll have much more on our website coming up a little bit later, guys. But if you have any other questions, you can send them my way. Of course, this is a difficult topic for a lot, and we want to make sure everybody is safe, especially if you're expecting a little nugget like myself. Back to you.
Very good. Thanks, Dina.